Hi, this is Manos Brilakis from the Minneapolis Heart Institute. It is a great pleasure to introduce Dr. Risto Jussila from the Helsinki Heart Hospital, who is going to present case 77 for the second edition of the manual CTO Interventions. Risto, thank you again so much for presenting this case for the book.
Thank you so much. It's a great pleasure to present this case. It's about 64 years old male, hypertension as a risk factor, and ex-smoker. CCS class 3, and echo was normal. So this is the first picture. So you can see it's CTO of RCA, and it's totally occluded in the ostium. Here we can see some collaterals coming on the periphery of the right coronary artery, and obviously this is a case for a retrograde approach, because you don't have anything to go after on the right side. So some pictures so we can visualize the right periphery, and then we go down. This is microcatheter and wire, and I'm trying to find the septal to go down to the right coronary. And here we go. It's a great collateral that goes. You don't see it so much, but it's there. Sometimes you don't see the collaterals at all, but they are still there. This is not so close, so I have to do it again. Now we are closer, but it's still under the right branch.
Great, and then if I can see here, it looks like you have an epicardial collateral, but obviously you prefer to have the septal whenever you can, right? So even if it's
Yes.
a CC0 septal, it looks like you're very close to crossing that.
Yes. And here we go then. And now we are in the right coronary artery, and following with, of course, with the microcatheter, and going up to right ostium. And here we go. It's very, very hard. It's like a stone, and it's very difficult to come through. And the risk is that I was afraid of make a dissection in the aortic wall. So back again and take another wire. As you can see, it's going wrong way.
Why was that? Was it a...
This is actually Conquest Pro 12.
Okay.
So it's a stiff wire. I wanted to have a stiff wire, of course, because I didn't want to wire look like this. So it's going up to aortic wall, I'm afraid. But then I took Boston's new Hornet, coming closer to the occlusion, and Hornet 14, and with that I could make the path to the ascending aorta. And then I took RG3 wire, and was trying to snare it. So it's not so easy, because this patient had a quite wide ascending aorta, so I needed to go to the arch and even lower to get my wire snared. And when I've done this, you have to remember, you don't pull, you just push. So otherwise you will squeeze the heart, and it will cause big troubles. So there are sometimes need for inserting the retrograde guidewire into the antegrade guidewire, guide catheter, and there are 3 loop snares such as the end snare and a treve, and I think they are more effective in capturing the guidewire compared with the single loop snares such as the gooseneck snare, because the snare is much it's a little snare, and these tulip formed snares are much bigger and easier to use. Here we have a picture of end snare and gooseneck amplats. And it's very important to remember that you are pushing the retrograde guide until it guide wire until it's it's coming out from the antegrade guide hub, and allowing that way the antegrade guide to be reseated into the antegrade coronary artery. Something that is very, very important is that you should not snare short wires, and if that happens, you're in big trouble. You can try to pull out the wire from the antegrade guide without attempting to retrieve it from the tonal artery direction. And now we have done we have RG3 around the heart, and after this it's a regular PCI. So I'm ballooning, making a PTCA here, and making pads for the stents. One thing more that is very important here when you are taking out microcatheter, so you don't suck in the left guide. It's very, very important to have your eyes on the left guide. And this is the final result. Thank you.
Perfect. Thank you very much. So that was an excellent case. So I guess the lessons here are that when you have an ostial RCA, you want to go retrograde because there's no way to work undergrade, and that was a very nice demonstration of that.
Yes.
And then the second lesson is that to get back into the aorta, you had to use a very stiff wire.
Yes.
And it looks like the Hornet 14 was the one that worked in this particular case.
Yes, yes, it did. Yes.
And then the third lesson is how to snare, and it was a very nice demonstration that you want to use the 3-loop snares if you can. And then, as you said, you don't want to be pulling the snare, but you're going to be pushing the wire from the retrograde guide so as to avoid the guides coming in and causing strangulation of the heart, essentially. So I think these are very key points to know when we do retrograde in general, and of course, specifically on the right coronary artery. And also, I noticed for the snares, you use a JR guide. You don't use an amplatz guide. Is that right?
Yes. Yes.
And I guess presumably because you don't need the amplatz support, because the support is coming from the retrograde gear.
Yes.
Wonderful. Well, I really appreciate it. Thank you so much for presenting this amazing case.
Thank you. It was a pleasure for me. Thank you.
Wonderful. Thank you.